So, do you guys wondering how speech disorders are diagnosed? Basically, there is a system called Denver Articulation Screening Exam, or DASE. This test evaluates the clarity in pronunciation of the children in between age 2 until 7 years old. So, DASE examination only require 5-minute test, and it uses various of exercises to assess child speech. Also, this test evaluate the child clarity of pronunciation as well as their speech sound, their pitch, and also anything that related to the sound. So, what is the purpose of DASE? So, basically, the purpose of DASE is to identify speech sound errors made by children in between 2 to 7 years old. DASE helps professionals to determine if a child's speech disorders are developmentally appropriate or if they indicate a speech sound disorder. So, there are two components of DASE. The first one is consonant sounds and the second one is word position. So, the consonant sounds assess child's ability to produce 21 consonant sounds in different word position. For example, like p, b, m, t, and so on and so forth. So for word position, it evaluates the child's ability to produce a consonant sounds at the beginning, in the middle, and at the end of the word. Different word position can reveal the pattern of errors that help in diagnosis. So how DASE examination looks like. The examiner will list down all of the words containing target sound to the child, and the words are carefully chosen for children to assess wide range of speech sound in different contexts. And after that, the examiner will mark the children's response whether it's incorrect or correct based on the target sound that is produced accurately. Some of the errors can include substitution, omission, distortion, and addition of sound. And lastly, the result will interpret to determine the overall child's performance and to identify the speech sound errors. So you can see here that this assessment is diagnosing the speech sound disorders and to help planning for appropriate intervention. And for the next one is Early Language Milestone Scale 2. So basically, this one is a test or assessment to develop or to measure the early language development in the age of birth until the 36-month age. So the purpose for this ELMS2 is to track the child's progress in various language skills and to identify potential language or any delays and disorders. The ELMS2 is to assess the wide range of language abilities and including the receptive language and expressive language. So for information, the receptive language is understanding of the language and expressive language is the use of the language. So ELMS items are related to the vocabulary, syntax, pragmatic, morphology, receptive language, and lastly expressive language. So we are going to explain the details of all the 6 items related to the ELMS2. Okay, for the first one is vocabulary. So basically, vocabulary is to assess the child's ability to understand and use words. So this include both common everyday use word and abstract vocabulary. Next one is syntax. Syntax basically to evaluate the child's understanding and the use of sentence structure. For example, like plural, pronouns, word order, or even verb tense. Okay, next is pragmatic. Pragmatic is to examine the child's social communication skill. So basically, here we can observe the children how they talk with their family, with their friends, and other different social contexts. Next one is morphology. So basically, morphology is to assess child's understanding and the use of morpheme, which is the smallest unit in language. Basically, something related to the plurals, verb ending, and also their grammatical markers. So for receptive language is to measure the child's ability to use the spoken language, how they respond to the questions, how they answer the questions. So basically, that's how receptive language is. And lastly, the expressive language. Expressive language is to evaluate the child's ability to use the language to fulfill their needs, to express their thoughts, their ideas, and so on and so forth. Okay, for the last diagnosis, which is the Peabody Picture Vocabulary Test Revised, or PPVTR. So basically, what is the purpose of this PPVTR? The purpose of this PPVTR is to assess the child's ability to understand and define words based on their knowledge and the word's meaning itself. Okay, so it represents a series of picture, and asks the individual to define the picture based on their knowledge of the word and represents the meaning of the given word. For example, children. Children are given the pictures, and what they need to do is they need to choose the picture that describes the given word. So for the people who has several intellectual disabilities or blind, cannot proceed to this assessment because they need to choose the picture and look at the picture, choose the right one that describes the given word. So note that this PPVTR has been revised and has been renewed over the years. So people who wants to do this assessment need to seek for the professionals for the accurate and meaningful result. So that is all for all the 3 diagnoses that I already explained to you guys. Let's move forward to the treatment.